How do we best help children with autism thrive in a world that's often not designed for them? Today, I'm talking about one of the most common therapies for kids with autism, applied behavior analysis, or ABA therapy. But is it the right solution? Stick around because this conversation is going to get interesting. Before we dive in, don't forget to hit that subscribe button so you don't miss out on these great informational videos about autism. So, what exactly is ABA therapy? You may have heard about it if you know someone with autism or have a family member who's been diagnosed. ABA therapy is based on the idea that you can shape behavior by using rewards and consequences. Sounds simple, right? It focuses on teaching skills and reducing behaviors that might be harmful or disruptive. But here's where things get complicated. Some people think ABA therapy is a game changer, while others believe it's too rigid or even harmful. So, where does the truth lie? Let's break it down. In the next few minutes, we're going to explore both the benefits, the drawbacks of ABA therapy, so you can decide for yourself whether it's a good fit for your child, student, or someone you know. But first, let's start with the pros. ABA therapy has been around for over 50 years and is backed by a lot of research. One of the biggest advantages is that it's individualized. That means each child's program is designed to meet their unique needs. For instance, if a child struggles with communication, ABA might focus on helping them learn how to express themselves, whether through words, pictures, or even sign language. Here's another point. ABA therapy focuses on positive reinforcement. That means when a child does something good, like making eye contact, sharing a toy, or following instructions, they are rewarded. This helps them build up the skills they need to navigate everyday life. And guess what? Studies show that early intervention using ABA can lead to in-social skills, communication, and even IQ. In fact, a 2024 study found that children who started ABA therapy before age 5 showed major improvements in behavior and skill development compared to those who didn't. But here's something to think about. Is ABA the way to help children with autism? Are there other, perhaps less structured approaches that could work just as well or even better? Shortly, we'll dive into that, but first take a moment to subscribe to our channel. Let me ask you this. Have you ever felt torn between different treatment options for someone you care about? It can be overwhelming, right? You're not alone in feeling that way. We'll look at some of the concerns about ABA therapy in just a moment. But first, if you're finding this information helpful, make sure to subscribe to our channel. You won't want to miss what's coming up next. While ABA therapy can be very effective, it's not without controversy. Some people argue that it's too focused on changing behaviors to fit into societal norms, rather than accepting the child for who they are. Critics say this can make children feel like there's something wrong with them rather than celebrating their unique strengths. Another concern? ABA therapy can be intense. Some programs involve 20 to 40 hours a week of structured therapy. That's like having a full-time job, and some families worry that this leaves little room for play or just being a kid. And then there's the cost. ABA therapy is one of the most expensive treatments for autism, often costing tens of thousands of dollars per year. While many insurance plans cover ABA, not everyone has access to it. So it's important to weigh the financial impact alongside the potential benefits. So, if ABA therapy isn't a perfect fit for every child, what else is out there? Some families choose therapies like speech therapy, occupational therapy, or play-based interventions. These approaches focus more on building specific skills in a less structured, more flexible environment. For instance, play therapy encourages children to use their natural creativity and curiosity to learn without the strict guidelines ABA might impose. Other families focus on sensory integration therapy, which helps children who have sensory sensitivities, something very common in kids with autism. But here's a key question. How do you know which therapy is right for your child? The answer isn't always clear-cut, and it often comes down to what works best for your child's individual needs and your family's situation. Have you or someone you know tried different therapies for autism? What worked for you? Drop a comment below. We'd love to hear about your experiences. As we wrap up, it's important to remember that no single therapy is a one-size-fits-all solution. ABA therapy has helped many children make incredible progress, but it's not the only option, and for some, it may not be the best fit. So, what's the final takeaway? When it comes to autism therapy, it's crucial to do your research, ask questions, and make the choice that feels right for your child and your family. No matter which path you choose, know that there are resources and support available to help your child thrive. Before you go, don't forget to hit that subscribe button. If you found this video helpful, share it with others who might be looking for answers too. Thanks for watching, and remember, no matter where you are on your autism journey, you're not alone. Subscribe now for more videos like this, and we'll see you in the next one.